Hello, I'm Brian Haug, President of the American Journal of Managed Care.
And I'm Justin Gallagher, Associate Publisher of AJMC.
We know you've enjoyed Managed Care Minute, and this week we bring you our first edition of Week in Review from the Managed Markets News Network.
This week, the White House moved to fix two common consumer complaints about the Affordable Care Act. Doctor directories are often inaccurate, and consumers are hit with unexpected bills not covered by insurance. The American Medical Association said doctors are frustrated by this problem too, because they don't want to refer their patients to specialists who are outside their health plan.
But a spokesperson for America's health insurance plans said the problem is hard to fix because doctors frequently move in and out of health plans.
The Obama administration made another move this week to enforce the Affordable Care Act.
On Monday, payers were told they must cover all forms of birth control without a copayment. Rules for covering genetic testing and counseling were made clear, especially for women with a family history of breast cancer and BRCA mutations. As Joy Larson Hadel, president of the National Society of Genetic Counselors, told AJMC last fall, the news that Angelina Jolie had surgery due to a BRCA1 status had raised awareness and caused more women to inquire about testing.
After Angelina Jolie had given her op-ed piece in the New York Times a little over a year ago, it really helped to propel the conversation about family history, the importance of what those cancers might be in the family history, whether it's in early age of onset, for example, and the value that a genetic test could have to either reduce that risk or help to identify cancer early.
The biggest meeting of the year for the cancer community convenes in 2 weeks when the American Society of Clinical Oncology gathers in Chicago. More results on Opdivo in non-small cell lung cancer and in combination with Yervoy for metastatic melanoma are expected.
Other highly anticipated results are the full data from the Helios trial, which compares the efficacy of Imbruvica with Artrianda compared with Artrianda and placebo in CLL and SLL.
Also expected are Phase 3 results from elotuzumab plus Revlimid and dexamethasone in multiple myeloma. Elotuzumab's breakthrough status and high response rates in Phase 2 have many waiting for these results.
This will be the next opportunity for ASCO to continue its year-long discussion on the financial challenges in cancer care, which reached a peak in March when an ASCO survey found that 1/4 of community practices were considering a hospital affiliation. 72% still operate in a fee-for-service structure, but that is rapidly changing.
ASCO President Dr. Peter Yu talked to AJMC earlier this year about the challenges of fee-for-service in cancer care.
So what we're seeing now is a demand to at least add on to the fee-for-service some accountability by physicians that what they're doing adds value, that the resources being consumed were justified, and that the outcomes achieved were what were intended.
Our final story comes from the Government Accountability Office, which this week found that just 5% of all Medicaid-only enrollees accounted for nearly half of all spending between 2009 and 2011. Most of the spending occurs among those with 5 chronic conditions: diabetes, asthma, HIV/AIDS, or a substance abuse or mental health diagnosis.
At AJMC, we talked about how to engage these hard-to-treat patients at our recent meeting of the ACO and Emerging Healthcare Delivery Coalition. And finally, there's still time to make a nomination for our first ever Emerging Leader in Managed Care Research Award. The winner and runners-up will be part of the celebration when we mark our 20th year of publication this fall in Orlando, Florida. To nominate a candidate, email us at info@ajmc.com.
We hope you enjoyed the Week in Review. From all of us here at the Managed Market News Network, I'm Brian Haug.
And I'm Justin Gallagher. Thanks for joining us.